Yeah, Shubh Raksha Bandhan. In this video, we will try to discuss something in English because it is more directed towards the resident doctors as well as the MBBS students. So first, we will understand what is about the pain, and it's difficult to define the pain because everybody knows what is it. Okay, some terms does not need the definition. Still, if we want to describe it, we can see the definition here. It's basically unpleasant, unwanted, and emotional response to from the particular organ or particular site that is described as a pain. Now what especially we see in this pain is how this pain helps us to understand, means how we should interpret this particular pain and what this pain tells us about. Okay, so the pain is divided into two parts, that is, one is nociceptive pain and one is neuropathic pain, and one you can tell the dysfunctional pain. So how this actually all things works, it is very easy to decode. Once we understand it, it seems that it is very easy. So what is our usual system? For example, we take the example of this our hand. There are the nerves endings in our hand. There is a skin, then there is a subcutaneous tissue, then there is a muscles, tendons, bones, okay, then blood vessels. Okay, all these things are present into the hand or practically in any part of the body. I am just giving the example of a hand. From here the nerve endings comes from all of these skin as well as the internal bone, muscle, tendon, everything, and that nerves, the signal goes into the spinal cord, and from spinal cord the signal goes into the brain, and that's how the things work. So whenever so the pain can happen at multi level. First, the pain can occur in the organs from where it has the nerves is getting arised. So that pain is called the nociceptive pain. Means what? Nociceptive means noxious, receptive. Okay, receptive means to receive something, and noxious means it's irritating, it's unwanted, that is called noxious. Okay, so nociceptors, that means the receptors which are present in the tissue, which detects these types of noxious stimuli, which detects these types of noxious substance. Okay, and that's why when the pain is felt by that, it is called the nociceptive pains. So basically nociceptive pains means the problem actually lies into the tissue. For example, there is a prick of a thorn to my finger, so that is called the actual tissue damage is getting there. Okay, another thing is like that. For example, I do extreme exercise, okay, and then the muscle gets extremely tense and stretched, so at that time I will also feel the pain. Like I do the exercise like this, gripping exercise for a longer time, I will feel the pain. Okay, so at that time the minor tissue damage has been happened due to this particular exercise, so that pain will also be there. Okay, so that is also nociceptive pain. Nociceptive pains means something actually has happened to the tissue. Okay, something actually noxious stimuli has hit the tissue, that is called the nociceptive pain. Another pain is called a neuropathic pain. Neuropathic pain means what? Actual target organ does not have anything. Actual target organs are all functioning well, perfectly, but the problems actually lies into the nerve. I will give you the example like herpes zoster. That herpes zoster virus remains into the ganglia of the nerves, and when they gets reactivated, when the immunity goes down. So basically this happens when this particular virus gets dormant in silent stage in our ganglia, nerve ganglia, in our nerve roots they remain silent, and after so many years when everything immunity and goes down, that time they gets reactivated and that gets infects the nerve, and we can see the vesicle and blebs on the root of that whole nerve. So that is called a neuropathic pain. Neuropathic pain means nerve actually has a problem. Another thing is that so this is called the basically neuropathic pain. Now another pain is dysfunctional pain. Dysfunctional pain means what? tissue is okay, there is no noxious stimuli or there is no unwanted stimuli at the tissue, nerve is also okay, the nerve is also not getting irritated, but the perception of pain is different, means patient feels that there is a pain. It may be the psychological or it may not be psychological, it may be actual, but somehow the interpretation of pain is different and we are not able to find any problem actually inside that particular organ or nerve. Just I give you the example like fibromyalgia. In fibromyalgia, patient has a vague pain in shoulder and like so many back pain and everything, and you go for MRI and everything is normal, still there is a pain. So now what will you call this? So this is called a dysfunctional pain. So there is maybe some interaction between the tissue and nerve getting altered, or the interpretation of the pain by the person itself is different. So this may be the another reason. And another example I like give you, like irritable bowel syndrome. Irritable bowel syndrome means in that patient has a complaint of vague abdominal pain. Patient cannot localize, patient will tell there, sir, I have abdominal pain. Patient has to go for bowel movements, means patient goes multiple time in the toilet, okay, and patient is not getting sensation that abdomen is completely empty. Patient may have a diarrhea or constipation, means the vague symptoms, okay, and you go for sonography and CT scan and everything you do, but everything comes to be normal, but still there is a pain. So that termed as irritable bowel syndrome. So we don't know actually what is actually happening. So this is called the dysfunctional pain. So these are the three categories. One is nociceptive, that is actual problem lies at the tissue level. Another is neuropathic, means tissue is okay but nerves has a problem. And third one is dysfunctional, means everything is okay but perception of pain is different, or the interaction between the tissue and the nerves is not that much normal, okay. So these are the three types of pain. And now the nociceptive pain is especially important because we want to learn it about in a surgery, and that's how the patient gives us the history. So it can be divided into three parts. One is superficial, another is deep, and another is visceral, and it is very easy to understand also. There is no need to remember things. I have given you the example, whenever there is a prick on the skin, or whenever somebody pulls our skin like this or twists the skin like this, so this all sensation. Or for example, we touch any hot vessel and we feel that there is a quite hot, okay. So these all type of sensation that are superficial, they are above the skin and they are sharply localized, okay. Patient can tell that I have a pain in this part of the finger and this part of my finger is okay. So that sharp demarcation of pain is there. It is called the superficial variety of nociceptive pain. Another is deep variety. Deep means anything which is deep to the skin, especially for example if we talk about the hand, it about the muscles of the hand, or you can say the tendons, the ligaments, the bones, the blood vessels, fascia, everything is beneath the skin. So that all muscles, musculoskeletal system, practically whole musculoskeletal system will cover into the deep part. So whenever we exercise and we feel that pain because once what happens, somebody who is not exercising regularly and day one that particular person goes into the gym, all muscle getting stretched, and that he particularly feels very much pain, okay, because that is the pain, okay, that is called the deep pain, okay. So whenever the muscle gets stretched, okay, so this is all a deep variety of pain. Another, I give you the example, sometimes there is inflammation of a muscle, that is called myositis, okay. Sometimes the inflammation of tendon, the tendinitis is there. So these all type of internal muscle and bone, osteomyelitis, okay, inflammation of a bone. So all these things will also give a pain, and that will call a deep variety of nociceptive pain. And now the third category is there, is the visceral nociceptive pain. Whenever the viscera get involved, like organ of our body gets involved, and that type of pain when we feel, it is called a visceral variety of nociceptive pain. Like I give you the example, how actually that actually happens, like in hepatitis. In hepatitis, what happens? The liver gets inflamed, so size of the liver gets increases. Whenever the inflammation, the size of that particular organ increases, and at that time the capsule which is around the liver, okay, that also get stretched, as well as the visceral peritoneum which is covering the liver, it also get stretched, and that time the pain is getting felt, and that is called the visceral pain. Another variety is gastroenteritis, dysentery. When patient gets the dysentery or the severe gastroenteritis type of infection into the small intestine, at that time what will happen? The inflammation, the intestine will get irritated, and that's time the intestine will work, means they will work very powerfully, and that contraction leads to the sensation in the transmitted by the visceral peritoneum, and patient gets pain. Another thing is that for example, in appendicitis what happen? The appendix gets inflamed and the peritoneal layer which is on the appendix gets stretched, and patient feels the pain. So basically viscera feels pain when the viscera gets stretched. When the size of particular organ gets increases, the surrounding peritoneal layers or surrounding layers is getting stretched, and that is the one mechanism how the pain get produced. And in some cases, whenever there is a ischemia, whenever some organ does not get a blood supply, or whenever some organ does not get a this oxygen supply, then also that pain sensation arises. The classical example is myocardial infarction. When particular wall of a heart does not get the proper blood supply due to the clot in that blood vessels, we all know that, and that leads to the pain sensation. But the importance of here is that as we go from superficial to deep and from deep to visceral, the localization of pain becomes very faint and faint. In superficial variety of this pain, patient can tell that the pain is here and pain is not here. In deep, for example, we do the extreme shoulder exercise, so we can tell that I have a pain in my shoulder, okay, but we cannot exactly tell in which particular muscle or tendon or we have a pain, okay. So it is vague pain, we cannot tell, but still you can tell the region that I have a pain in here, okay. As compared to, for example, somebody takes that nail and pricks it here, we can sharply tell that pinprick is here and not here. But when we do exercise, the whole shoulder gets painful. So that is the means deep pain is not that much localized, and visceral pain is even not that much. Visceral pain is very vague. Deep pain still somewhat it is localized. Visceral pain is very vague and it is very difficult to localize, and patient just feel that there is something uneasiness or something is not going good, and that is the vague feeling of a patient when there is a visceral nociceptive type of a pain. So this is how the pain is divided: superficial variety, deep variety, and visceral variety of a nociceptive pain. Nociceptive pains means there is actual problem happened at a tissue level. And another variety is our neuropathic pain, means there is a problem in a transmission, okay, the tissue is everything is okay. And third one is a dysfunctional pain, means the perception of pain is changed or psychological, we don't know, but that is called a dysfunctional type of pain. So this is how the pain is actually divided. So this was about the pain, and in next part we will learn something about the different varieties of pain by which patient comes to us, and how that actually transforms in a means what actually patient is telling to us and what is actually happening inside the body. That we will see in a next part.